Nova LEAP Health is a healthcare services company in one of the fastest growing sectors of healthcare, providing care services focused on those with dementia. Nova LEAP Health just reported its Q3 2023 financial results, posting record adjusted EBITDA. And we've got Nova LEAP CEO Chris Dobbin here to discuss the quarter and the company's outlook. I'm Martin Gago with Market Radius Research. It's Tuesday, November the 14th. Please remember, this is neither recommendation or investment advice. We're here to learn about the company. Chris, thank you very much for joining us here today. Congrats on a solid quarter. And please give us an overview on your results.
Thanks very much, Martin. Appreciate you having me again. Yeah, look, good quarter for us. Pretty solid, as I indicated in my comments. Revenue was pretty flat, like not a lot of movement there, just based on the ebbs and flows of the business. But the gross margin percent was up, as it has been over the last few quarters. We've done a good job of controlling costs. And we had record, adjusted EBITDA both in the U.S. operating segment as well as on a consolidated basis. So, added cash to the balance sheet, great operating results, probably the best sort of operating results in our history. And we're in a terrific debt position. We've announced we're paying off all the bank debt in Q4. So it's a great spot to be in as a microcap company in terms of cash flow producing, record results, and pretty minimal debt. So pretty pleased with where we are.
So what was driving these record revenues or these record profits? You seem to be executing very well here. What makes the business execute well? Like easy customer acquisition, or you mentioned managing costs. Can you just dig down into some of the elements that help drive a solid quarter?
I think we have to go back a few quarters just to understand sort of where we were to where we are now. Because I mean, there's a bit of a transition that's happened over the last 12 months. You'll remember as we exited COVID, our numbers had been hit pretty hard, and we had a labor supply shortage as well as which was really the main factor, and that led to a decrease, particularly in our U.S. operating segment, just the results we were producing, and so. We streamlined.
And just to highlight this, it wasn't for a lack of patients. It was a lack of service caregivers to give those patients service. The limiting factor was how many people you could hire.
Yeah, I mean, we don't generally refer them as patients. We call them clients just because we're primarily non-medical. I mean, we do have some medical, obviously, but they're clients to us because they're long-standing, recurring revenue. We go in there, the same hours every day, every week. But it was really a labor supply issue, right? Because that's what we're providing the care through our individual caregivers that go into seniors' home. And so that was a real issue through COVID. And so as we exited COVID, if you were to go back through my quarterly comments, I mean, they're pretty consistent, right? We're streamlining operations. We're getting the U.S. operating segment in particular, turned around. And we've seen that. I mean, we've had 2 quarters in a row with record results from adjusted EBITDA perspective in our U.S. operating segment. And, that adjusted EBITDA on a quarterly basis, I think, is probably up, 2.5 times if we were to go back 12 months. So pretty significant uptick. So, all the things that we focused on all the way up through the end of Q1 of this year, those were all about getting everything, streamlined and making sure we have the right people, running the different agencies and we've done a great job of that, and our team's done a great job of that. And so, that's really what's led to the record results. On the labor front, things are definitely better than what they were. Again, I talk about this all the time and say for the next 10 or 20 years, we'll always be looking for more great caregivers, but, they're definitely better than what they were, in terms of labor availability. And again, that goes to show, it shows up in our results. So, we're really in a great spot as we enter 2024. We've set a new base in terms of what our cash flow profile is, no debt, terrific team. And so, a lot of upside for the company.
Should investors be thinking that kind of the performance out of this quarter be consistent through the coming quarters, or is there some seasonality, I don't know, through Christmas where people, I don't know, maybe need more or less care, or it's just kind of consistent throughout the seasons through the year?
Yeah, I mean, I think if they look at Q2 and then see that we've done even better in Q3, I think that should give investors confidence that, okay, this isn't just some blip. Look, we've set a new base here as a result of the work we've done. And that's where we are. So we're building from the current base. Now, is there some seasonality? I mean, we have 2, sort of, I guess, traditional big events, in the US around Thanksgiving and, end of the year holidays and so on. And sometimes the adult children are back and they see mom or dad. And so maybe our caregivers aren't in there for a period of time. But I mean, we're talking about just a couple holiday seasons. They're nothing significant. So really, yeah, people should expect, and I certainly expect that the base that we set for Q2 and Q3 will continue on in the 2024. And obviously, I talk about continuous improvement on a regular basis, and our plan is to build upon these results. And so that's really what we're focused on as we enter the next year.
All right. The other aspect of your business is you are an acquisitive healthcare services company, acquiring and consolidating a very fragmented industry. You haven't done much of that recently, obviously focused on operations. What does your M&A pipeline look like? What's that in environment? And you don't have debt, or you're about to be unrid. You'll have gotten rid of your debt here shortly. So sort of fully loaded on the balance sheet for acquisition mode. How is that pipeline looking? What are your thoughts on that?
Yeah, there's lots of opportunities out there for acquisitions. I mean, there's been less acquisition activity in our space just as a result of the higher interest rate environment, as you might expect across many sectors. But the good place about where we are is we don't have any debt. I mean, the bank debt's been paid off. And so what does that mean? Well, it means we have a greater borrowing capacity. And so when we look at deals, it's conceivable that we could start to do a couple acquisitions without, just by utilizing our debt capacity, right? So, I think there's really two things that I'm excited about as we enter 2024. One is we continue to build momentum on our operational results. So, building upon what have been two record quarters, and then two, starting to overlay some M&A. And so I think if we can do those successfully, then I think we're going to have a terrific year in 2024.
All right, that makes a lot of sense. You've got an interesting perspective on the U.S. economy. You see a lot inside of people's homes and caregiving, and then you're on the labor front. The labor market seems to be loosening up a bit, but the economy, despite all the worries out there, seems to be doing quite well. Low unemployment. And any perspectives you see on your client's ability to pay, or you mentioned the labor market a bit, but any thoughts on what you see in the environment, in the economic environment?
Yeah, I mean, our clients' ability to pay really hasn't changed from what it's ever been, and we've always been excellent at collections, and so we really haven't noticed any difference from that perspective. Just one of the things you always think about if there was a recession, or if the labor market, takes a downturn and so on. But again, throughout our history, I think our collection rate's been around 99.8%, so it's been really, exceptional. So nothing from that perspective that we've really noticed. On the labor frontage, again, in certain pockets, like it's been better than what it's been in the past, which is good. We get access to more caregivers, great caregivers going to people's homes, which is positive. The things I tend to worry about, particularly in Canada, have to do more with the residential mortgage side. Those variable rates, or people that are getting renewed, what impact that's going to have on the economy. But again, our business, we have about, probably about 20% of our business is in Canada. So we're less impacted by that. But, I don't know. I don't really have any great insights. I don't think beyond our clients continue to pay. The labor pool has been a little bit better than what it's been over the last 12 months, which is good. And our business continues to grow because, we have an aging demographic, which will be like this for the next, 40 years.
All right. Chris, I think we've covered the main points. Anything you want to highlight or mention before we wrap it up here?
I think for investors, you kind of look at, where are we right now from an EBITDA perspective. And I think I mentioned in a press release that, we're doing north of 2.1 million in Canadian dollars. We have a market cap that's about 15 million. You think about, if you believe that we can continue to improve operational performance like we have the last couple of quarters, and if you believe that we can, do some M&A in 2024 by utilizing debt, and you start to see sort of where that can take us from an EBITDA perspective, I think, from my perspective, it's a pretty attractive spot to be right now from an investor. And so, I just ask people to take a look at us from an investment perspective, and make the decision you think is good. But I can't think of a better time in our history where you know, everything is just sort of ticking along as it should. So again, great spot to be in, and pretty excited about what's to come in the years ahead.
All right, Chris, thanks a lot for joining us and giving us an update. Have a great day.
Thanks, Martin. Appreciate it.